Hello everyone, my name is Dr. Adnan Sharif and I'm a consultant nephrologist at the Queen Elizabeth Hospital in Birmingham. By nephrologist that means I look after people with kidney problems and the main focus of my work is looking after people who've had a kidney transplant. We're joined today by a patient who has experienced a very common problem that we often see for patients after they've had a kidney transplant, and that's cytomegalovirus. And through talking about his experience and what he went through and how he was treated, what we're hoping to do is to raise awareness about cytomegalovirus, or CMV for short, show you how it's tested for and how it's treated, and to demonstrate that CMV is no longer the feared problem that it was before, but it's something that we want to make sure that our patients have some awareness about. That gives me pleasure to introduce our patient, Faizawan, who will give us a little introduction about himself and his journey that he's had with his kidney transplants.
Hi, nice to meet you too. My name's Faizawan, and I was born with kidney failure. And throughout my lifetime, I've had 3 kidney transplants, one at the age of 3, then a live donor from my father at the age of 14 when I first experienced CMV. As I was in pediatrics at the time and it wasn't as well known, I was treated by being via IV antibiotics. Um, and I was kind of isolated as well at the time. Um, so that was my kind of first experience of it. And then when I had my third kidney transplant, which was in July 2020, fortunately the technology and the science had advanced, and I was able to take a course of tablets, which I could do at home, to treat the CMV I had. So I was wondering, what's CMV infection and what's CMV disease and what are the differences?
So yeah, there's lots of different terminology that is used, and it's important to know what they all mean. So I'll start with the most basic, which is CMV replication, and that just means that the doctors and nurses have been able to pick up evidence that the CMV virus is replicating in your blood or urine or wherever the sample's being collected for. With CMV replication, most patients may have absolutely no symptoms at all, and that's called CMV replication. If patients have CMV replication and they have some symptoms, often they can be very non-specific flu-like symptoms, kind of feeling tired, muscle aches, maybe some fevers, then we call that CMV syndrome. And the next step beyond CMV syndrome will be CMV disease, and that's where patients will have all of the above, but also some evidence that the CMV is affecting or damaging some type of organ within the body. And CMV can affect any part of your body, but the commonest that we see with regards to symptoms and signs in our patients is CMV in the gastrointestinal tract. So that's signs of CMV infection causing some kind of harm anywhere from your mouth all the way down to your tail end. That's the commonest, but we do see patients often come in with symptoms and signs of CMV disease affecting different organs as well.
So how can you catch CMV? Because if you do Google it, it comes up as a herpes virus, and people, I assume, will automatically assume it's sexually transmitted, which doesn't look great, especially when I was 14 and had my transplant.
So I think this is an important thing, and it also is, it's the danger of kind of going to Google for all your answers. So it is correct that CMV belongs to a family which is called the herpes virus, but there are over 100 herpes virus in existence, of which about 8 or so affect humans. And as an example, the varicella zoster virus, which we often call the chickenpox virus, that's also a type of herpes virus. And so CMV belongs to that family, but it's different from the herpes virus. And CMV can be caught in many, many ways. It can be caught from bodily fluids, so intimate contact, yes, but also from coughs, sneezes, and sharing utensils, for example. You can even get it from parent to baby. So mothers can pass it on to their children. That's congenital CMV. So there's lots of ways that it can be passed. And that's why so many people in the population will have had some kind of exposure to CMV.
Could you explain why the immune system could maybe not be functioning as well for transplant patients?
Yes, of course. So your immune system is designed to do a certain job, and that job of your immune system is to fight and destroy anything that your immune system doesn't recognize as belonging to yourself. So it's designed to attack bugs, parasites, viruses, cancerous looking cells, and your immune system does a very effective job when it comes to that. The problem when it comes to transplantation is that if we've taken somebody else's organ, or kidney, for example, and put it into you, then your immune system will not know that that's that kidney's been put in for a good thing. It will just instantly look at it and think that's a foreign object that's going to cause me harm. I need to destroy that kidney, and that's what we call rejection. When your immune system looks at this foreign kidney and mounts a response to attack it and to try and destroy it. And therefore, to try and stop your immune system from doing the job that it's designed to do, the only way that we can make transplantation successful and reduce the risk of rejection is to try and dampen down your immune system a little bit. And that's where the anti-rejection tablets, or immune suppression, as they're also known, come into play. So what those tablets are designed to do is to reduce your risk of getting rejection of your transplanted organ. The caveat to that is that by weakening your immune system a little bit, we are putting you at slightly higher risk of certain infections and cancers. And when it comes to infections, you're at risk of getting any common infection, but also what we call opportunistic infections. So these are infections which, for healthy adults with normal working immune systems, they very rarely cause a problem. But when your immune system is weak, either because it's been born like that, or you've acquired a problem that's made it like that, or you're taking tablets that make your immune system weaker, then those viruses, which are normally lying dormant, sleeping away, can use the opportunity of a weak immune system and try and cause some mischief. We'll look at a video which summarizes some of what we've already talked about with regards to the CMV virus.
Cytomegalovirus overview. If a healthy individual is infected with cytomegalovirus, or CMV, they generally show no symptoms. Their immune system keeps the virus under control and prevents it from multiplying and causing illness. However, in patients where the immune system has been weakened, for example in transplant patients who must take anti-rejection tablets to prevent their organ from being rejected, CMV can multiply as the immune system cannot bring the virus under control. If left untreated, the virus can multiply even further, leading to CMV infection and disease, which can affect many organs in the body, such as the lungs, liver, and kidney. CMV can be transmitted in various ways. It can be transmitted via organ transplantation, mother to baby, via blood, contact of bodily fluids, and coughing and sneezing. It is one of the most common viruses to cause severe infection in transplant patients. A person who has never been infected with CMV is referred to as CMV negative, and someone who has been infected with the virus is referred to as CMV positive. Transplant patients who are at highest risk of developing CMV infection are those who are CMV negative and are receiving an organ from a donor who is CMV positive. If the patient is CMV positive and their donor is CMV positive, this places the patient at a moderate risk of developing CMV infection following their transplant. Patients are also at a moderate risk of CMV infection when they are CMV positive, but the organ donor is CMV negative. Finally, patients are at the lowest risk of developing CMV infection when they are CMV negative and their organ donor is also CMV negative.
So how can CMV be prevented?
So, I mean, there's standard hygienic ways that you can do it, things which we are currently doing a lot more frequently, hand washing, cleaning things down. But in reality, from a transplant perspective, we normally have one of two strategies to try and reduce the risk of patients getting CMV. One of those is prophylaxis, and that's the commonest strategy, and that's where the transplant center will determine what risk that particular patient has of getting CMV, Some of that relates to what that individual CMV status is, and also the status of the donor kidney as well. And if you're deemed to be at medium or high risk, then you will be given an antiviral therapy to try and reduce the risk of you getting CMV for the first 3 months or 6 months after your transplant, because the early period after your transplant is a time when your burden of immune suppression is at its highest, and that's probably the highest time for your risk of getting CMV. Fewer centres do a different strategy, which is called preemptive therapy, and that's where they will take routine tests to see if they are finding any evidence of CMV replication in your blood, and as soon as they do, they will then start you on a course of treatment. Both strategies are very good, both work very well, and it very much just depends on what your centre is used to as to what kind of strategy you will have.
Is it possible to get CMV more than once?
Unfortunately, it is possible to get CMV more than one time. For healthy adults, it's rare. Once you get CMV, your immune system forms antibodies, it recognizes it, and normally the virus will lie dormant. But because you have antibodies to one strain, that does not mean that you have protection to all other strains, and therefore you could get CMV more than once. And that's more likely for transplant patients who, again, will also form antibodies, but they may not form sufficient level of antibodies, or they may be exposed to other strains. And also for transplant patients, their journeys are a lot different from the general population. So if transplant patients were to get CMV, but later on over the course of their life, they were to suddenly get something like rejection, well then when you get rejection, that's a sign that your immune suppression needs to be bumped up a little bit, and therefore by increasing your immune suppression, we may treat your rejection, but simultaneously we may be putting you at a slightly higher risk of getting CMV reactivation.